where do you draw the line between a quote unquote junior dog versus senior dog? Obviously mostly depends on the size of the dog, right? The bigger the dog, the younger they're considered a senior. The Great Dane is considered a senior at 5 years old, right? In my mind, right? And everybody's different, right? I think generally speaking, seven is like the cutoff, right? So once you're 7, you're technically a senior pet. But certainly in larger breed dogs, we bump that down, right?
Larger dogs age faster.
Their heart kind of gives out quicker. Their organs give out quicker. Their joints start to show wear and tear more quickly as compared to smaller dogs. And so they pick up arthritis, they pick up heart disease, they pick up all these things a lot quicker and a lot sooner than, say, like a teacup Chihuahua. And so, again, veterinary medicine is all about preventative care. You know, the earlier we find out about a disease, the longer we can slow the progression of the disease. The vast majority of diseases that we see, we can't cure them. Like we can't cure arthritis. We can't replace your valve in your dog's heart. And so the earlier we catch it, the better off we are.
So are larger dogs more prone to like medical issues?
1,000%. Yeah, I mean,
Or is that breed dependent
oh,
exclusively?
both, right? You know, like certain breeds are predisposed to certain things. You know, the brachycephalics have breathing issues. The dachshunds have back issues. You know, the cavaliers, they've got heart issues. Rottweilers have bone cancer. But then you push up into like the size of the dog and the same thing happens, right?
What pound range are you thinking like in terms of more issues? Like 80 pound plus, 100 pound plus, 60 pound plus?
That's a good question. I think generally speaking, like 70 pounds, 75 pounds is when you start to see when you talk about arthritis, right? And to be honest with you, right, the vast majority of dogs that we unfortunately have to euthanize is not because they're end-stage kidney disease or end-stage liver disease or whatever. It's most of the time because they can't get around.
And so like the bigger animals have
100%.
arthritis.
Yeah, because you got to think, man, it's you got 130 pounds on a knee versus 5 pounds on a knee. Yeah. You know what I mean? The anatomy is same. The bones might be a little bit different here or there, or bigger or smaller, but like the overall anatomy is relatively similar. And so you're just putting so much more torque and pressure on those joints, like you're gonna have problems.
So I guess like preventative care is important across, but more so.
Oh yeah.
To like if you have a bigger animal, they need to really be monitored regularly, or at least taken care of properly.
Exercise, all that.
Yeah, I think weight's a big one, right? In bigger dogs, overweight dogs. If you're supposed to be an 80-pound dog and you're a 100-pound dog, like, buddy, like we're gonna have joint issues pretty quickly. Sure. You know what I mean? And so the bigger you are, the more important staying at an ideal weight is important, right? If you're supposed to be 15 pounds and you're 40 pounds, like you're not exempt from this. Like you're still gonna have problems. I just think it's much more apparent in large breed dogs versus small. And I think also something that like we probably don't think about is small breed dog has a joint problem going up and down the stairs. I pick them up and carry them up the stairs, right? So it's like not that big of a deal. And like owners don't think about it or don't notice it. But hey, 125-pound Great Dane, 180-pound Great Dane, right? If they have joint problems and they can't go up and down the stairs, like that's a problem. Owner can't pick them up. And so I think a lot of arthritis and difficulty, difficulty getting up and down or joint problems kind of are masked in smaller breeds because owners just pick them up, right? And they don't really think like, oh yeah, they're just being silly. Like they don't like going upstairs. It's like, nah, man, your dog's in pain. That's why it's not going upstairs. And it happens young, right? So I saw a dog this morning, right? It was a 92-pound dog. And I gave it a good physical exam and I noticed like a little hesitant when pulling the hips back, right? Like I tried to stretch the hips and the dog just kind of didn't like it very much. I was like, oh, that's odd. But the dog was a little bit nervous, so maybe it was nothing. So I started asking questions. And I was like, hey, does your dog jump up and down out of the car? And she's like, no, never has. how's it going up and down stairs? She's like, oh, she's like scared of the stairs. She doesn't like walking around on hardwood floors. And I think to myself, like, well, that could be behavioral, right? Like maybe we just don't like stairs. Maybe we don't like hardwood floors. But man, like when you start putting these pieces together, it's like, well, sure, maybe it's behavior, but what if it's like your dog's in pain? It doesn't like going up and down the stairs because it hurts. It doesn't like jumping up and down out of the car because it hurts. It doesn't like walking on hardwood floors because they kind of slip a little bit and it's painful. And so I'm not saying that's like a slam, and this dog was 5, right? So I'm not saying those signs, her telling me that and the decreased range of motion, that's not a slam dunk for hip dysplasia by any means, but it certainly like raises those questions like, that's odd. And so we need to do some x-rays. Like we need to make sure, hey, like, do you have any hip dysplasia? Do you have any early onset arthritis? Like what's going on? And once you determine what it is, then the question becomes, hey, how do you prolong it, right? How do you slow the progression of it?
Sure.
And that's what it's all about. And this dog was 5, so it wasn't a senior pet. I haven't done x-rays yet, but we're going to. And I'll follow up next time.